Heart issues in young adults often present differently than the classic symptoms seen in older populations. Because young people are generally considered low risk, these signs are frequently dismissed as stress, caffeine intake, or poor sleep. However, identifying these markers early can be life saving, especially in cases of underlying congenital heart conditions or lifestyle induced disorders. While everyone feels tired, cardiac fatigue is distinct. A sudden noticeable drop in your ability to perform activities that were easy a month ago. Getting winded up a single flight of stairs or feeling wiped out for hours after routine workout. This can indicate the heart is struggling to pump efficiently, that is early heart failure or an undiagnosed valve issue. It is common for young adults to experience heart flutters due to anxiety or energy drinks, but certain patterns are red flags. Rapid or irregular heartbeats that occur while resting or are accompanied by lightheadedness. If the racing starts suddenly and feels like a flip-flop in the chest that won't stop. This could be an arrhythmia like SVT, supraventricular tachycardia, or AFib, atrial fibrillation, which are becoming more common in younger age groups. 0.5% of people under 40 years of age suffer from AF, with more than 5% of those over 65 and more than 10% of those more than 80 years of age being affected. Young adults rarely experience the elephant on chest feeling. Instead, it may feel like dull pressure, tightness, or a burning sensation that is often mistaken for acid reflux or indigestion. If the heartburn worsens with physical exertion and disappears with rest, it is more likely related to the heart than the stomach. Fainting during or immediately after physical activity is never normal for a healthy young adult. Feeling grayed out or losing consciousness suddenly. This is a primary warning sign for hypertrophic cardiomyopathy, a leading cause of sudden cardiac arrest in young athletes, or electrical signaling issues in the heart. Noticing that your shoes feel tight or there are deep sock marks around your ankles at the end of the day. Peripheral edema or swelling occurs when the heart isn't pumping strongly enough to pull blood back up from the legs, causing fluid to leak into the tissues. Since anxiety is prevalent in young adults, it often masks cardiac symptoms. Comparing onset in anxiety attack often triggered by stress or thoughts. In potential heart issue, it can happen during rest or exertion. Duration in anxiety attack usually peaks within 10 to 20 minutes, but it may persist or occur with activity in potential heart issues. Pain location is often localized to one spot in anxiety attack, but it may radiate to neck, jaw, or left arm in potential heart issue. Symptoms usually resolve with calming in anxiety attack, while symptoms often persist regardless of mode in potential heart issues. If you experience sudden chest pain that radiates through the jaw or arm, cold sweats, or fainting, seek emergency medical care immediately.